Now we are going to see the changes in follow-up studies.
Yes. So, for example, this one is the baseline study and this one is the follow-up. So, what we will do, we have to first process the baseline study using the Q volumetric CMI.
But this time we have to take the oncology one. I think we have
Oncology, yes, yes. So, you can select oncology and left start. Auto motion correction, corrected, paused, enter the patient details, suppose 170, for example 50, male, let's say 100 millicurie, and time you keep 2 clicks down, 1 click down, and let's say 90,
for lutetium it is 90.
around 90. Okay. Okay, done. So go back to this tab, and if you want quantitative information, do the segmentation and see where is the lesion. Yeah. So we have the tools here. Let's say use this tool and just click.
To select, I think, kidney also.
Yeah. So if kidney is selected, you can just okay. So this is good case. So here suppose kidney is selected. Now you want to separate it, right? So we have a knife here.
Okay.
Use the knife to cut it.
Okay.
Now this is shaded.
Okay. So
And this is unshaded. So here you have options. Shaded area you want to cut or you want to keep.
Okay. So we want to keep.
Yes, cut and keep.
Okay. So now it will grow for that only.
Right. So this is the only area selected.
Okay.
And here you get the quantitative information. You can rename. In case you want have more tumors, let's say this uptake. So second is added with add organ. It is not an organ, so we have to add new. As a lesion L2 is already there, just click here and you can rename if you want. And use this one to select the lesion, right? If you want to grow it further, you just click outside, it will grow again.
Okay.
This is too big. Okay.
Okay.
Then click accept and save everything. Even the quantitative information will be also saved. So you can click save and exit. This is the result series will be generated. And now you have to process the follow-up study along with the results of the previous study. So I selected the results from the previous and the follow-up study. I will select the same application. Again, you can perform the automatic corrections for each FOV and select the corrected dataset for further reconstruction. So software is automatically comparing the current with the previous, and this is the screen where it is automatically registering from previous to current study based on the CT images. Okay, so each FOV you can see it is perfectly.
But whether segmentation is being done correctly or not.
Segmentation, for segmentation you have to again enter all these details. For example, this time again 170, patient height, let's say 55.
69, I think it was reselected because it
Maybe
is a follow-up patient.
maybe it is changed.
Okay.
You can load from the previous study, and then measured activity, let's say this time 21, and correct the date and time. Sensitivity you have to measure and enter the exact value, 90 is something
Approximation.
approximately. Okay, so now you can click on the table. So you have to go to the segmentation. Then you can see the previous and the current tables. So automatically it is pasted. Now you can see whether it is correctly done or not. You can scroll and check. You can increase the intensity and see. Right?
Okay.
If you find that it is not correct, then you can just delete the ROI and redraw it using these tools.
Okay.
For
The
example,
first one is the
yeah,
first study and second one is the follow-up
this is
study.
this is the previous, this is the new.
Okay.
And यहाँ पे यहाँ पे सपोज आप उसको एडिट या डिलीट करना चाहते हो, तो कम हियर एंड reset, delete segment, clear segment,
Okay.
or reprocess segment. So you can just delete it and just redraw it. Let it be bigger. Suppose this is the image. Okay. Now you can cut using the knife. This one. Then cut and keep. Okay.
Manual drawing can also be done because
Manually also these are the manual
ROIs.
rectangle ROIs, and this you can also adjust, like these are the adjust tool for adjusting the ROIs. You can.
So here we need to cut it slice by slice or just one if we draw
One, because all these tools are 3D VUIs, 3D tools.
Okay.
So just one
We'll
cut,
adjust for the other slices.
one cut will separate the in 3D direction. But sometimes if the tumor is very large and you see that it has not cut the desired areas, then you can scroll and cut it again.
Okay. Manual modifications can be.
Manual these are the manual modifying this thing. Then click accept. If you go to the compare mode, then it will compare side by side and it will show you the percentage change. So previously it was 81 volume and now it's 70. So there is a 14% reduction. For the lesion 2, there is no change. It is almost of same size.
Okay. So the treatment response monitoring can be done.
Treatment monitoring can be done with this. So basically these softwares are for Theranostics studies where you are doing lots of therapeutic isotopes. So that's all about this.
Thank you so much.
Thank you, sir.